Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students. And that's what I intend to do with this podcast.
On today's episode, I have some special guests from my university's undergraduate nursing research and evidence-based practice course. Lindsey Atwood, Gracie Boone, Santana Levias, Isabella Nauts, and Jack Walker are joining us to discuss their evidence-based practice project. Before they get started with their discussion, though, I want to let our listeners know that I have shared a copy of these students' evidence-based practice posters to accompany this podcast episode. You can find this in the show notes of whatever podcast platform you're currently listening to. Now, without further delay, let's turn the show over to Isabella to get us started.
Hey listeners, my name is Isabella Nauts, and on behalf of my other group members, I'd like to welcome you to our podcast discussing the research and work we have completed in our undergraduate nursing research and evidence-based practice course. The title of our presentation is A Comparative Study of Recovery Time in Patients Undergoing Laparoscopic versus Open Appendectomy. The members of our work group, Group 7, are Lindsey Atwood, Jack Walker, Santana Levias, Gracie Boone, and me, Isabella Nauts. We are all undergraduate nursing students in our 6th semester at McNeese State University in Lake Charles, Louisiana. We hope that you enjoy our podcast and maybe even learn something new today.
Thank you for introducing your team and for presenting your project topic, Isabella. Comparing recovery times between laparoscopic and open appendectomy is an important area of interest, especially as surgical approaches continue to evolve over time and influence patient outcomes. To help our listeners understand why your group chose to explore this topic, Isabella, can you begin by sharing the problem your team set out to address and why is it important for us to examine this?
Appendectomies, which are a surgical operation to remove the appendix, are one of the most performed emergency surgical procedures to treat acute appendicitis. Up until recent years, the open surgical method has been performed, but there has been a rise in minimally invasive techniques, which have made the laparoscopic method and laparoscopic appendectomy a popular alternative. Laparoscopic surgery is a surgical technique in which short, narrow tubes are inserted into the abdomen through small incisions. The laparoscopic surgical method has several advantages like reduced postoperative pain, smaller incisions, which ultimately reduce scarring, and a faster return to normal activities. Even with these advantages, some studies say that the outcomes between laparoscopic versus open appendectomy may not differ much in terms of recovery time and complications. The topic about which surgical technique provides the best recovery outcomes creates some uncertainty. Knowing whether laparoscopic appendectomies really result in a shorter recovery time post-operatively when compared to open surgery is vital in providing evidence-based practice and improving patient outcomes. Our study aims to provide that information by comparing the post-operative recovery time between adult patients undergoing a laparoscopic versus open appendectomy. In terms of the nursing world, and our topic's importance and relation to nursing practice, is the difference in care nurses need to provide. Laparoscopic procedures often lead to less postoperative pain, so nurses may need to give fewer pain medications and monitor pain differently. They also lead to smaller incision sites, so nurses provide less complex wound care, but they do still need to monitor for infection. And they have faster recovery times. So this means nurses must prepare their patients for earlier discharge and provide thorough home care instruction and education for their patients. In each case, nurses should use clinical judgment and individualized care based on each patient's condition, monitor for complications, and educate their patients. Understanding evidence on post-operative recovery times helps nurses deliver evidence-based care and improve patient outcomes after a laparoscopic appendectomy.
Isabella, thank you so much for that background. Your explanation highlights why appendectomies remain such a critical component of emergency surgical care, and it helps us to clarify how laparoscopic procedures differ from open approaches. Understanding these distinctions sets the stage for asking focused questions about outcomes and recovery. To guide your team's investigation, you developed an evidence-based practice question. So, Jack, can you share your EBP question that your group created and how you use that to shape your research process?
Now that we have established the significance of this evidence-based practice topic to the nursing profession, I want to share our group's evidence-based practice question with our listeners. We crafted our evidence-based practice question in the PICO format to include adult patients who are undergoing an appendectomy and then compared laparoscopic surgery versus open surgery and on the impact that it has shortening postoperative recovery time. Our question that guides our literature search on our project topic was, in adult patients undergoing an appendectomy, does laparoscopic surgery result in shorter postoperative recovery time compared to an open surgery?
Thanks for sharing your group's PICO question with our listeners, Jack. This question served to focus your group's investigations into the literature. So can you tell us more about how you used that PICO question to help you and your teammates find published research studies about your selected topic?
We used our group's PICO question to create keywords to search the following university library databases: Academic Search Complete, CENTAL Complete, and Medline. Some of the keywords that were used for our searches included laparoscopic or open and appendectomy, laparoscopic or open and recovery, postoperative complications and laparoscopic versus open appendectomy and wound healing, and laparoscopic versus open appendectomy. We also set specific search limiters on our searches, including English, full text, peer-reviewed, quantitative, and in the last 5 years. When I was researching evidence-based resources to answer our PICO question, making an account on CENTAL Complete was very helpful because it allowed me to put them into a project folder so I could save them and they not be lost if I had to take a break and work on it another time. And it also helped me from picking sources that I'd already picked. I started to struggle finding articles that were relevant to our PICO question because many of them did not apply to our adult population, or when I found the article that looked promising, there was not a full text version available. A helpful trick that I learned when searching for evidence-based resources was not to spend too much time under one search. Once the articles started to get repetitive and I wasn't finding resources that were helpful, I would switch to a new search or even a new database that would give me a fresh start.
I appreciate your sharing some helpful insights into your group's literature search process, Jack. It's great to hear how your team used available tools, like saving articles in CENTAL folders, to stay organized and to keep track of the most relevant studies throughout this process. A strong search strategy really does make the rest of the evidence-based practice process more manageable. Now that the literature had been gathered and reviewed, let's take a closer look at what the research actually showed. Gracie, can you walk us through the key evidence that your group identified?
After conducting our literature search using the databases and keywords we described earlier, our group selected 5 high-quality research studies comparing laparoscopic and open appendectomy. These studies examined a range of populations from adults and pediatric patients to individuals with obesity and consistently demonstrated that laparoscopic appendectomy, or LA, produces faster recovery times and fewer postoperative complications than the traditional open approach. In the first study by DESI 2025, researchers compared postoperative wound infection rates between open and laparoscopic procedures in 300 patients. Their findings showed that wound infections were significantly lower among patients who underwent laparoscopic appendectomy, and these patients also had shorter hospital stays. The study emphasized that minimally invasive surgery decreases postoperative morbidity and helps refine clinical practice guidelines favoring laparoscopic techniques. A large-scale, multi-center study by Schlauberg, 2025, further supported these results. With nearly 32,000 participants across Germany, this study demonstrated that laparoscopic appendectomy is associated with lower mortality, fewer complications such as abscesses or sepsis, and significantly shorter hospital stays when compared to open or converted procedures. Because of these consistent advantages, the authors identified laparoscopic appendectomy as the current gold standard for appendectomy worldwide. The Hewson 2022 study focused specifically on obese adult patients, an important subgroup because obesity can complicate both surgery and healing. Even though laparoscopic procedures took slightly longer to perform, patients in this group reported less postoperative pain, fewer wound infections, shorter hospitalizations, and higher quality of life scores 2 weeks after surgery. These findings are particularly meaningful for nurses as they highlight the need for tailored postoperative education and pain management strategies in patients recovering from laparoscopic procedures. Our fourth study, Botchway 2021, reviewed outcomes in pediatric patients under 13 years old. These results showed a statistically significant reduction in hospital stay for children who had laparoscopic appendectomy compared to those who underwent open surgery. Interestingly, the rate of postoperative readmission and reoperation was similar between groups, showing that laparoscopic surgery can be safely and effectively used even in younger populations when performed by trained surgeons. Finally, Shin 2022 conducted a randomized controlled trial comparing endoscopic retrograde appendicitis therapy, laparoscopic appendectomy, and open appendectomy. While their focus was broader, the results again demonstrated that laparoscopic procedures produce fewer complications, minimal wound infections, and quicker recovery times, reinforcing the overall evidence in favor of laparoscopic surgery as the most efficient and patient-friendly method. When we synthesized all 5 studies, several consistent themes emerged. Across diverse settings and populations, laparoscopic appendectomy resulted in shorter hospital stays and faster recovery, reduced postoperative pain, lower rates of wound infection and complications, and improved quality of life after discharge. Although the laparoscopic technique may involve a slightly longer operative time, the benefits of quicker recovery, fewer infections, and reduced hospital costs outweigh this minor disadvantage. In summary, the collective evidence strongly supports laparoscopic appendectomy as the preferred approach for most patients, reinforcing what nurses observe in clinical practice. Patients recover faster, experience less pain, and return to their normal activities sooner. These findings not only strengthen evidence-based surgical decision-making, but also guide nurses in providing optimal postoperative care and patient education.
Excellent discussion of the studies that your group reviewed, Gracie. The consistent evidence you described, showing fewer wound complications, faster recovery, shorter hospital stays, and even lower mortality with the laparoscopic approach, really emphasizes how meaningful the choice of surgical approach can be for patient outcomes. Your group's attention to special populations, such as individuals with obesity who face increased surgical risk, also highlights the importance of tailoring care to patient-specific factors. With these outcomes in mind, it's important to consider how nurses translate this information into nursing practice. So, Santana, can you share the nursing implications that your group identified?
Based on the information our group reviewed, we noted some synthesized implications for nursing practice. First one, educate patients on the pros and cons of open appendectomy versus laparoscopic appendectomy before they come up with the decision. So we want to do that. We want to provide education. It helps the patients to make more informed decisions about their surgical options. It also gives them autonomy, lets them choose which one they would prefer. And it just reduces their overall anxiety about the procedure. We want to monitor close for signs of infection and early detection and management of infection. It can prevent serious issues along the way, and it just aids in healing quickly and decreases their hospital stay, which ultimately, we want. Thirdly, assess the pain levels. You want to do that frequently. And just to stay on top of that, it promotes them to early ambulate. It gives them constant comfort and ease. And it also assists in a, overall recovery. So the nurses who would benefit most from this information would be pre-op, perioperative, PACU, and post-op nurses in same-day surgery, outpatient, surgical units, because, they're involved in the care of the patient before surgery and after surgery and monitoring them throughout.
Thanks, Santana. Your points about educating patients on their surgical options, closely monitoring for postoperative complications, and encouraging early ambulation all underscore the central role that nurses play in promoting safer recovery. Ensuring that patients are informed and supported is essential regardless of the surgical technique that's used. In addition to these clinical responsibilities, your group also examined how the current evidence points to areas that need further investigation. So with that in mind, Santana, can you share the research implications your team identified next with our audience?
There's still some knowledge gaps remaining in the published literature surrounding our topic. Therefore, our group did develop some implications for future research. First, research on complicated appendectomies. That's like perforations and gangrenous appendectomies. You want to have a knowledge of that working in the emergency room, ICU, the operating room, or even post-surgical. A lot of times the patients come to you after the procedure with infection, sometimes severe, and so it's good to be able to intervene, have a knowledge on what could go wrong after a surgery, whether it be open or laparoscopic, just to be able to care for that patient. And then also cost difference. So, it's not talked about enough, but there's obviously a cost difference between laparoscopic and open appendectomies. You would want to have a knowledge of that as a nurse to be able to inform the patient if they were to ask, also just to be able to give them, different information when it comes to that. And then also the long-term quality of life after these procedures, knowing what to expect after each, whether you would need to go to rehab, if you would need home health to come in to assist, just having an understanding of what you would be able to do and not do after surgery. That's in regard to pain, if you're going to be able to get around, work, just return to a normal, life, be able to perform your normal activities of daily living.
Okay, so your group has given us a lot of excellent information about the current state of the science surrounding the selected clinical practice topic. After all the research studies your group reviewed, including any considerations of study weaknesses and continued gaps in the present literature, what was your group's overall literature-based answer to the original PICO question you shared with us earlier?
After all of the research studies that our group reviewed, we were able to determine an evidence-based answer to our evidence-based practice question. In patients undergoing appendectomy, laparoscopic surgery results in shorter postoperative recovery times compared to open surgery. Across all of the literature we reviewed, laparoscopic appendectomies resulted in fewer wound infections, shorter recovery time, and less postoperative pain. Keeping the patient healthy with no infections following surgery is our greatest concern. The nursing care for a patient who received an open appendectomy versus a laparoscopic appendectomy would be different. Patients who received an open appendectomy will have larger incision sites, greater risk for infection, more pain, and will take longer to heal and return to normal activities. This would mean that more pain medication is needed, more infections are present, and patients will have to stay longer than necessary in the hospital. A critical component of being a nurse is advocating for your patient. Knowing the risk versus benefits of a laparoscopic appendectomy or an open appendectomy gives you the opportunity to help give your patient the greatest chance at a quick, easy recovery with no postoperative infections. Understanding which type of surgery is more beneficial to your patient allows you to educate them efficiently and advocate for them. Reviewing research studies and evidence-based practice is extremely important to the profession of nursing. Doing this will help you provide the utmost care to your patients, resulting in fewer wound infections, shorter hospital stays, and faster recovery times. Without research studies and evidence-based practice, we may not have understood the benefit of a laparoscopic appendectomy over an open appendectomy.
Thank you for summarizing your group's conclusions so clearly, Lindsey. The evidence you reviewed offers a strong and consistent message. Laparoscopic appendectomy is associated with shorter recovery times, fewer wound infections, and less postoperative pain when compared with open surgical approaches. Your group's findings aligned closely with the PICO question and reinforce how surgical advancements can significantly improve patient outcomes. You also highlighted an essential takeaway for future practice: the responsibility nurses have to remain current with emerging evidence in their specialty areas. Staying informed allows us to educate patients accurately, supports shared decision-making, and advocate for the safest, most effective care. To our listeners, thank you for joining us for today's discussions. Evidence-based practice strengthens the quality of care we provide, and your engagement in conversations like this one helps advance our profession overall. We hope you'll join us for the next episode of Nursing Research Tips.